Okay, it's allergy, at least process in your brain kind of time. For millions of Americans, spring allergies are nothing to sneeze at. They can be downright debilitating. As spring weather begins to thaw the ice and snow, we really didn't get much ice and snow. Pollen counts will rise. Dr. Al Johnson, how are you?
Good. Good morning.
Doctor of Internal Medicine, Dr. Al Johnson. I've certainly had allergies. Nothing, knock on wood, yet, but what do we do?
Well, if you have allergies, and 40% of the population has some type of allergy, it's kind of important to figure out what you are allergic to, and then avoidance is the first thing.
Well, how do you know if it's pollen? I mean, it's got to breathe, Al.
Well, exactly. So that's the second point, is that if it is pollen, then you're probably going to have to use some sort of medication or get treated. The antihistamines help. The non-drowsy ones like Claritin and Allegra.
Those are over-the-counter now. It used to be prescription. I think they're over-the-counter, right?
Right,
okay.
Right. And then they have over-the-counter nasal steroid now, that if you have severe nasal congestion and the antihistamines aren't helping much, you can use that. And then I suggest that people use the nasal rinse, excuse me, with the saline to help wash all those pollens out before they go to bed when they get up in the morning.
Right. Okay. What about the winter here around here? It just was pretty darn nice and not very cold. Does that matter at all for this spring?
Yeah, it does, because what happens is everything starts to bloom at once. And so you get overloaded. Gotcha. So you get it all at once instead of coming in the normal sequence.
I got you. All right. So determine what you're allergic to. Again, that's tricky. Do you have to go to an allergist to do that?
They usually do testing, allergy testing, and you could do a blood test to help to find out, or they can do prick or intradermal test on your skin to find out.
I see.
So there's a couple different methods to do that. And it does help to define what it is. And then if it's not getting better, allergy immunotherapy or allergy shots really helps build up tolerance. It's the only thing that does build up tolerance.
Yeah, yeah. Well, I'm going to look weird wearing a mask everywhere, won't I?
Well, now they do have sublingual drops that are used a lot. So you don't actually have to inject or be injected, but you can take the sublingual drops.
Okay.
So that may be an alternative for people.
All right, Al. Do you have allergies?
A little bit.
Okay.
And if you need to know more, you go to my website.
Which is what?
JohnsonMedicalAssociates.com.
So when you have something going on, is it hard to get in to see you?
I keep spots open for patients that are having trouble, so we try to take care of people.
That's good of you.
I basically that tries to meet a demand and a need that to take care of the patients.
Well, good for you, and you're still going to be a doctor even though Obamacare is the law of the land?
Yes, I have a kind of a cash-based practice. And I deal a lot with indoor mold toxicity. So people that are having trouble where they've had a contaminated house, aren't feeling better, continue to have all kinds of funny symptoms, which includes, kind of difficulty with memory, fatigue, numbness, tingling.
Yeah, that can be bad
gastrointestinal
stuff.
problems.
Real bad. That mold stuff can be really bad. Al, so you say cash-based business. So I come to you and I don't have insurance. How much will you charge me?
An office visit is $115, and that's sit down, talk, get treatment, make sure everything's okay.
It costs more for the plumber, doesn't it? I mean, it really does. That sounds very reasonable. All right,
exactly.
It's JohnsonMedicalAssociates.com. You're in Dallas, Al. I appreciate your time, buddy.
Thank you.
Thank you.